Everyone. This is Toya from Healthcare Collaboration, where we do ASC consulting. I am here to give you some brief education on some ASC deficiencies that I experienced in 2024. So, my name is Toya, and I've been dedicated 20 years to surgical services and healthcare and 10 years of ASC leadership. I'm currently an ASC consultant and a surveyor, so I enjoy helping others be successful in their careers, and my mentors were to me, as my mentors were to me. So it's a brief agenda, some common ASC deficiencies, some common ASC solutions, and then me, your ASC consultant, how to get a hold of me. Let's get into it. Common ASC deficiencies. So here are some citations that I would like to discuss with you, and the first one is credentialing. Credentialing is ensuring that you have providers in your organization that are verified to be the actual providers that they say they are and that they're operating safely. And so, what I commonly see is that medical providers have been credentialed, but there is nothing in the governing board meeting minutes that talk about these credentialed providers, or they have incomplete files where they don't have their OIG or National Practitioner Data Bank information located in there, expired documents such as DEA license, and then no peer review. So it's really key to put together a full credentialing policy and procedures as well as a peer review process to ensure that all of your providers are going through credentialing and you have all of the records to prove the work is done. Next up, patient rights. So a lot of times as a surveyor, I interview the staff and they are not aware of advance directives, or the box is not checked, or they're not being asked. And truthfully, advance directives aren't a common practice being utilized truly in ASCs, but it is a requirement. Another thing is the rights aren't visible to patients, so there should be patient rights posted in the lobby or the waiting room, and they need to be visible. And a part of the patient rights is the organization's information needs to be available to file a complaint. A lot of times we go in and that is not posted, and patients don't understand that they can file a complaint or a grievance about their care. Next up is medical records. Medical records, EMR or paper, they're fine. Surveyors are pretty flexible on both. But they're incomplete, missing signatures, dates, times, medications, or even follow-up of adverse reactions to medications. Medical record policies don't really match the current practice, so we'll go into an agency or a facility and they will have policies that talk about paper records and they are on an EMR. So it's super important to update your policies and procedures to what you're actually doing. The next thing is medical record audits are so key. And a lot of times people say they do 3% of records, and it depends on your volume, truthfully. But whenever possible, you want to get through those records, have other nurses review those records, making sure, especially paper records, making sure that all the T's are crossed and the I's are dotted. A lot of times there's missing signatures or missing to sign a consent. Patient has been discharged and the consent has never been signed. That will be an issue on survey that you don't want to deal with. Also, if you have any questions about any of these things we talk about, please feel free to email me and I can answer any questions that you have. Next up is the tracer patient. So for surgery centers, we typically observe 2 patients and we observe them from admission through their discharge. It is important that the leadership team gets the patient's permission for us to shadow. And as a part of this, we're observing the environment, hand hygiene, practices, who's wearing gloves when they're coming out to get a patient. Why are you wearing gloves? I don't know. So as a tracer patient, we commonly see citations for lack of hand hygiene, no heart and lung assessments, so the physician's not doing it. The nurses don't wear a stethoscope. Something is missing, and that is a requirement. The H&P update is not being performed. A lot of times there's confusion as to who should do that. It should be the physician, and he should update the H&P. There are some processes you can implement to make it easier for your physician, but ultimately they need to be updating the H&P, basically stating no concerns, okay to proceed with the surgery. Poor PACU assessments. So I have did some observations in PACU, and one of the things I'm noticing is that the nurses aren't wearing stethoscopes. And when I ask where the stethoscopes are, they're in a drawer. Someone says, they're in a drawer over there. So I go to the drawer and take a peek, and there is a jumbled mess of stethoscopes. And it's like, who's using these? It is important that stethoscopes are accessible and that you're doing full assessments of these patients. They have been given medication. I'll bet they are smaller doses than what they would get in the hospital. They still need a follow-up and assessment to make sure they have went back to a normal state. And then lack of PPE. So this can go from gloves to masks. I've seen people wearing gloves when they shouldn't be, or taking out trash and not wearing gloves when they should be. So, have PPE where it should be. Also, as leaders, do audits, do environmental rounding, infection control rounding, and just make sure that these people are following these rules and regulations, because a lot of times we get wrapped up in our patient care where we just do it, and we don't mean to be non-compliant. We're just trying to be done with our day, and that's the truth. Next up is environmental. So the building needs work, people. The chip paint, walls broken apart. It is really important that you fix these issues right away. They often can lead to infection control concerns or safety concerns as it relates to smoke, fires, and things like that. So it's important to get your walls fixed, fix your chip paint, get your ceilings, tiles replaced, clean the deep spots that nobody goes, clean those areas, make sure it's getting done. Improper cleaning is a huge thing because cleaning services are contracted, and they don't always have the staff to keep up with the demand of the cleaning processes and needs of a surgery center. So make sure you're auditing your cleaning company and doing spot checks on them to see what they're doing. I know that I did a spot check at one of my agencies and came in, and the person deep cleaning the OR were wearing street clothes. They thought that they didn't need to change because they were going to be brief about it. I was absolutely like, no, there is a process and policies to clean back in the OR. It was a mess. Anyways, improper cleaning. Check your cleaning company. And if you are an agency or a facility that is having your staff clean, you have to believe me, they do not want to do this cleaning. So the quality of their work typically is not as great because they want to get out of there after a long day. So be mindful of that and do spot checks on your cleaning. Next up is temperature and humidity. It is the bane of our existence, I tell you, the temperature and humidity logs and tracking. It can be a lot of work, but unfortunately is required, and you need to keep up with it. A lot of centers are moving towards the automatic tracking of temperature and humidity, where it just reads automatically and goes to a log. That is probably the most comforting piece of it, but if you're still on paper, you want to make sure that it's done every day that you are at the surgery center, and then keeping track of it and preparing it for survey because it will be reviewed. Broken tape or repaired equipment. So on your survey, it is important that, or anytime, but really anytime, if there is broken equipment or mattresses that are cut or things that need to be replaced, they need to be tagged and stored somewhere safely so they are not put into the operation of the day. The last thing you need is to be bringing out a broken IV machine, a broken wheelchair, and a patient gets hurt because the machine is not locked out or tagged out to prevent being used in patient care. Next up, environmental, missing drills. Fire drills are a pain. I get it. It is important to use any type of drills, weather drills, or any type of things that happen, not necessarily drills, reverse. It is imperative that you complete these fire drills or your tabletop drills as needed and document them for your regulations and for your survey and overall quality of care. But if you don't like drills, and trust me, I don't love drills, If you live in a state like mine where you have fires and frequent weather emergencies, use those to discuss with your team in an event. If the fire was to come to you, what would you guys do? Use these things that are actually happening in your surrounding as a part of your after action plan. Document it, write it up, discuss, evaluate, and again, document. That will count for your emergency preparedness testing. But not doing fire drills, not doing tabletops, and not documenting the things that are weather related or business related that impact your business will be a citation. I got medical records again. Well, let me just discuss medical records. So I'm going to put incomplete here, but the truth is I once had a doctor going in and dictating prior to him doing the procedure. He was a plastic surgeon. He knew what size breast he was going to implant into the patient, and so he would go in and talk up a storm and dictate. I had no idea until I started doing medical record audits that I noticed he was pre-charting his dictation. Thank God it wasn't a survey, but boy, did it take a long process and a lot of talking to this physician to get him to change his practice. So the mock survey allowed me the 3 months time prior to my survey to talk to him, switch it, get it into my copy of what my problems were with the medical records, and save myself from a citation. Again, policies don't match. If you're doing an EMR, then you want to document your processes for an EMR. Timely documentation when it needs to be due, when specimens, go out, come back, what the results were, what the pathology was. You want to make sure you get all that information into the patient's record. Don't leave it dangling at the office or in the EMR network somewhere. You got to pull it in, put it into the record, and make sure that you have encompassing complete care of that record for that patient when they visit your surgery center. Not audited or discussed at QAPI. So medical record issues are just a common practice, and it is important that when we track them, we track how often it's happening, who's doing it, we educate, and when all else fails, we create a quality improvement study. And we work on processes to improve our documentation for the medical record. Let me just check. So that's pretty much it for my common citations for ASCs for 2024. I have a lot more information, and I will be putting out more frequent videos just like this to be short and brief, but give a lot of education and tips or tricks. As always, if you have any questions, you can reach out to me. The way to get started is to quit talking and begin doing. So if you know that something needs fixing in your surgery center, let's get to it. I'm here to help. So in summary, this presentation highlights the common deficiencies identified during surveys for ambulatory surgery centers, and it really underscores the importance of proactive measures to address them. Each of these deficiencies require a detailed plan of correction and often demand significant time and effort, resulting in many plans being rejected. To navigate these challenges effectively, I encourage you to utilize my consulting services at Healthcare Collaboration to conduct a mock survey. By identifying these errors and areas of improvement before the actual survey occurs, we can collaboratively enhance your compliance efforts in bolstering your patient care and safety to ensure the ASC is well prepared. Together we can do this. Please reach out to me. I'm here to help. Thank you very much, everyone, and I will see you at my next little video. Take care.